Welcome back to Fox 9 All Day. Great to have you along with us here this afternoon. There was a New York Times article that sort of just caught our attention, and it's based off of a study that has been tracking cannabis use data over the years, saying that cannabis use disorder is increasing. So our ears just kind of perked up here because we wanted to talk more about this. So of course, you think about many states, of course, now allowing for more recreational use. You think of medical marijuana as well. So we just wanted to hear from a doctor and also answer any questions that you may have. We have been asking for your questions also during the 11 o'clock hour as well. So we have Dr. Alta DeRue here with us. She's the Chief Medical Officer of Hazelden Betty Ford. And Dr. DeRue, we appreciate your time because this is a really important conversation to have, especially right now. So thanks so much for being with us. So let's start here. We've heard people say, you know, cannabis is not addictive. I think when people think of addiction and you think of use, you think of maybe alcohol, cigarettes even. Marijuana, would you put that up there as well?
Yeah, definitely. People who smoke marijuana or use marijuana daily, 10% of them will develop a cannabis use disorder. So a cannabis use disorder has a DSM-5 diagnosis, just like opioid use disorder, just like alcohol use disorder, and we treat it in our facilities very frequently.
What have you been seeing? I think we want to get to one of our questions. Amber just came into my ear. Amber, if you want to pull up one of the questions, we can get right to it too, because I know we have to go through a lot. So this seems to be from Deb. Deb asked this question. Hi, doctor. I'm just curious. If you had to choose which is worse for your health, smoking, vaping, nicotine, or smoking marijuana? Thanks.
Wow, those are a lot of evils I see there. So I'm choosing like the least of all evils. So, you know, I would say none of them are good for you. The smoking the marijuana is concerning because not only are you getting a THC component that you may not be able to control, but then you also have the carcinogens that come along with the vape. So anything that's vaping, which is very unfortunately in right now amongst our youth, you're inhaling questionable levels, high concentrations of cannabis, but then you're also inhaling into your lungs these carcinogens, these toxins, poisons directly into your lungs. Now, there have been some small studies that show when somebody's trying to quit smoking that vaping nicotine can be a way to decrease use, but of all of those options up there, I would not endorse any of them. They're all going to have a lot of potential for addiction and harm in the lungs.
Yeah, and I get the question because I think sometimes people try to categorize what's worse, right? Like, oh, should I do this one over this one? And we try to figure out what can be better for our body, but as a doctor, you're like, none of them are better.
And you know, and we often see that in addiction, and it's called minimizing. Like, oh, I may drink only beer, but I don't drink the hard stuff. So when I see a question like that, it's like, I want to use some substance that gives me an effect. Which one is the least worst for me, so I can somehow justify its use?
Yeah. All right, Dr. DeRue, let's continue on with some of the questions. I believe Amber can pull up another one. Okay, this one from Betsy. For addiction expert, here we go. Are edibles healthier than alcohol for occasional recreational use?
So if we're talking about edibles like the gummies, and they have a lower concentration of cannabis, something like cannabidiol, which is your CBD, those do not produce a euphoria when you consume like a CBD gummy. So while I would say that it's not necessarily better for you, it's not going to have that euphoric or high impact that you would get by consuming straight cannabis. So if you had to choose your products, I would say the one that's least addictive would be something like the CBD with the gummies, because you don't get the euphoria of the strong THC.
Gummies are becoming so much more popular now, and even like when you think of THC in drinks, I feel like we see them absolutely everywhere. Is that also what you're seeing in your office as well?
Yes. So people are under the impression that if you were to drink a THC consumable at a store, or if you were to take a CBD gummy, that it wouldn't show up on a urine drug screen, and that's not true. It will show up on a urine drug screen, mostly because for THC, it will show up as cannabis, even at a low level, because you don't know what the concentrations are, and because these are not regulated by the Food and Drug Alcohol Association, then you don't know what the content is on it. So if you think that you're taking it because you want to avoid some type of positive on the urine drug screen, you have to be very careful. It's not very reliable.
All right, let's get to another question. Remember, I'm reading some of these for the first time as well. All right, this one from Louise. Many senior citizens are using THC or pot to sleep or relieve symptoms. Is use of cannabis products troublesome for people over 65?
Right. So we do see this a lot with folks over 65 using this as a sleep aid. For the short term, I see that it does provide some symptom relief for patients, but the problem is that when you stop, you get this rebound insomnia. So when you stop using, it's even more difficult for you to get to sleep. So even though it's very popular right now and it does sometimes give a soothing effect, those effects are usually short term and then they wear off after a while. And we don't have long-term data to show that it is effective for sleep.
Okay, let's get to another one for you, doctor. So this one from Mosh, I believe. How do clinicians differentiate between someone using cannabis to self-medicate for conditions like PTSD or anxiety versus the cannabis actually compounding those mental health symptoms?
So when somebody uses cannabis to treat their symptoms, we're not sure what symptoms that without being diagnosed by a physician, we don't know what those symptoms are or what the origination of those symptoms are that they're trying to treat. For example, you may be trying to use cannabis to treat your anxiety. Well, when you lay off the cannabis, your anxiety actually improves. And so there are other ways to treat sleeplessness or anxiety rather than using cannabis. We have proven and safe medications and methods like cognitive behavioral therapy that can help somebody treat those underlying symptoms instead of going to something like cannabis to pursue treatment.
And I'm curious, as we're getting ready to queue up another question here, what are you seeing the most right now? Like we talked about, some of these different items and products. What are you seeing at your office?
Well, we're seeing mostly alcohol use disorder is number one, right? That's
still number one?
That's still number one, okay. But we're seeing the vaping of the THC. We're seeing vaping of cannabis. That's how people are consuming it. And when we see people for treatment, that means that their cannabis use disorder, their use has either caused a psychosis, which is very frequent, or they have this what's called hyperemesis. You can get very sick, nausea and vomiting from smoking too much cannabis. So we're seeing that in our offices. So the people who come see us have been smoking the cannabis a lot and very high potency. So when they come in for treatment, when they've hit rock bottom and it's starting to interfere with the quality of their life, that's when they are consuming daily. They can't stop using, and they're using high potency. And it's mostly the vaping products, the vaping of the cannabis.
How do you know how much is too much, or does it depend on your body?
When it interferes with the quality of your life and you can't do your normal daily activities, you can't show up for work or meet your obligations with your children, that's too much. When you can't navigate out to your car without using, or if you can't drive your car without being high, that's too much.
Okay, Dr. DeRue, let's get to another question here as we have a little more time. All right, this one from Haley. How to help a teen stop their marijuana addiction?
Great question. This is a big problem with our teens. Vaping is very popular. It almost has that kind of sexy appeal like it did for cigarettes maybe 20, 30 years ago when that was a big thing. The first thing I would do is share the concern. Approach your teen in a very non-judgmental manner and remove the things that are influencing your child that's starting to use marijuana or starting to use cannabis. There is a supplement out on the market. It's called N-acetylcysteine, NAC, that you could buy at a grocery store. There's some evidence to show that it can decrease the cravings for cannabis. And if your teen cannot stop on their own, we have a youth facility in Plymouth, right here in Plymouth, Minnesota. We treat ages 14 to 26, and many children are in there for cannabis use disorder. So if you can't stop with just a simple supplement and support at home, we are there to help the family.
Wow, I just thought about when you said 14, I'm like 14-year-olds are addicted.
Yeah, it's very popular, unfortunately, within the high school system right now.
Wow.
A lot of high school administrators are battling it, parents are battling it. Yeah, big challenge.
Okay, let's see if we can get some more questions in. All right, this one's from Sophie. Do you think increase in the use of marijuana contributes to the increase in fertility issues? That's a great question.
Yeah, so like I discussed, I'm also an OBGYN, still deliver babies, do surgery. And yes, so using cannabis does affect male fertility and female fertility. So it can affect some ovulation parts on the female side, and then it also affects the sperm quality on the male side. So yes, absolutely. Wow. And it definitely does not help you get pregnant.
Yes, that I can see.
Yeah, but it definitely compromises fertility.
Wow.
Yeah,
wow.
Good question.
Because again, I think people just think alcohol when they think of stuff like that, of like what could be a hindrance to, you know, something like fertility. That's very interesting. Amber, you want us to keep rolling? Okay, last one. She says, let's get this. Oh, okay, this one from Grandma. Okay, so she says, my grandson is 16 years old. He has been to drug treatment in person and outpatient. He failed his drug test 4 times and inpatient treatment was recommended. His mother said that if he only smoked pot, she was fine with him not going back to treatment. I am concerned about brain development and the likelihood of trying harsher drugs. What is the expert's thoughts on him not going back? This would have been his 3rd time inpatient.
So Grandma, I hear you loud and clear, and your heart and your mind is in the right place. So your grandson would definitely benefit from residential treatment. What's going on is that people's perceived risk of cannabis is decreasing as we use it for recreational use across the United States. At a 16-year-old's brain development, their brain is not fully formed yet. And in fact, their neurologic development is highly impacted with cannabis at this time. So you are spot on by being concerned about your grandson's brain development. My suggestion would be to get him into residential treatment. And like I said, we have this in Plymouth. So right here locally, we have a great treatment center. And your grandson, he's not unique, unfortunately. Special to you, of course, but among his peers, there are many that are using cannabis right now. So I would not be okay with the 16-year-old smoking every day. You're spot on that it's compromising growth development in the brain that may never regain. So stopping it right now and having him recover would be the best path.
Yeah, and I'm glad you mentioned, you know, that's some of what you were saying, because I think some people in these situations think they're sort of alone in some of these processes. And, you know, as you kind of said there, it's not unique, unfortunately, and a lot of families are going through it. We appreciate your time. Thank you so much for
My
all
pleasure.
Of your insight. If anyone has any more questions or maybe any sort of places where they could go,
yes.
Can you share that with them, please?
Yep. HazeldenBettyFord.org if you get to our site. And of course, I would want anybody to get treatment from anywhere, but we're right here and we can help.
And also an OBGYN.
And also an OBGYN.
Double. Thank you so much again. We appreciate your time. Very important topic.